Hi everyone, Dr. Steph here, and today I want to talk to you about a very specific nutrient that is super important for so many different facets of healthy body function, that this is a reason why we have almost every single patient that we work with in all of our functional programs on this particular supplement, on this nutrient, and it's called glutathione. And I'm going to go through a few articles with you, talk to you about what glutathione is, what it actually can help with, and what the best forms and sources are. Because as you know, there's a lot of products on the market. It gets very confusing for people. And you want to make sure that if you're going to spend your money on supplements, that you want to make sure you're getting a good quality product that you're going to actually be able to uptake and absorb. And let's just talk. This is from WebMD, glutathione article right here. So yeah, I just pulled this definition up on WebMD so that you can see what this actually is. So glutathione is a substance produced naturally by the liver, and it is also found in food, fruits, vegetable, and meats. WebMD actually states that people take glutathione by mouth for treating cataracts and glaucoma, preventing aging, treating or preventing alcoholism, asthma, cancer, heart disease, atherosclerosis, high cholesterol, hepatitis, inflammation of the liver, liver disease, diseases that weaken the body's defense system, so autoimmune diseases, other immune diseases, infections, including AIDS and chronic fatigue syndrome, memory loss, Alzheimer's disease, osteoarthritis, Parkinson's disease. Glutathione is also used for maintaining the body's defense system, immune system, and fighting metal and drug poisoning. It's a very, very potent heavy metal chelator and can pull toxins out of the system. It's also used as a breather supplement, so breathed in through, for example, a nebulizer for treating lung diseases, including idiopathic pulmonary fibrosis, cystic fibrosis, and lung disease in people with HIV disease. And healthcare providers give glutathione as a shot by injection into the muscle for preventing poisonous side effects of cancer treatment / chemotherapy, and for treating the inability to father a child. So they actually inject it into men for male infertility. It can also be delivered through an IV, so intravenously, for preventing anemia in kidney patients undergoing hemodialysis treatment, preventing kidney problems after heart bypass surgery, treating Parkinson's disease, improving blood flow, decreasing clotting in individuals with hardening of the arteries or otherwise known as atherosclerosis, treating diabetes, and preventing toxic side effects of chemotherapy. And so what is glutathione? I will tell you that we have the ability to deliver this via IV in our office, and we have it in various forms, and depending on the issue that a patient has will determine what form that we give it in. But we have it in probably one of the most effectively absorbed methods, which is not even IV. We have a better form even than an IV as far as delivery into the cells of the body. So we'll get into that in a moment. So glutathione is considered the most important molecule you need to stay healthy and prevent aging, cancer, heart disease, dementia, and more. And it's necessary to treat everything from autism to Alzheimer's disease. It's considered the mother of all antioxidants. And there is just a plethora of really good information out there. The good news, according to this article, is that your body produces its own glutathione. We produce a ton of it in the liver, which makes sense because if glutathione is a major detoxifier, antioxidant, well, the liver is the detoxification organ. And so it's responsible for making it. It is an antioxidant that you recycle. So once you've detoxified, pulled something out, you hold on to it, recycle it, reclaim it, and then reactivate it. But the bad news is that toxins from poor diet, pollution, toxins, medication, stress, trauma, aging, infections, and radiation all deplete your glutathione. This is why people that get chemo and radiation therapy should also be getting, as an adjunct therapy, glutathione IVs or some type of delivery of glutathione, because that is really, really, really an onslaught of toxicity. So not only is the body dealing with trying to detoxify the cancer and kill the cancer and get rid of it, support the immune system through this process, but now you're overloading the system with chemicals that are toxic through chemotherapy and radiation. So imagine how depleted your glutathione will get. And you've got cancer likely because you are already depleted in glutathione. It's a little mind-boggling. But so what happens if you get low in glutathione is you're now susceptible to unrestrained cell disintegration from oxidative stress, free radicals, infection, and cancer. So your liver cells cannot break down the garbage. Your body cannot effectively break down the garbage, package it up safely, the toxins, and eliminate it. And your liver will start to get stressed and not able to keep up with the demand. The liver gets overloaded and damaged, and now we have a real big necessity to really go in there and help detoxify the system. Now, we have glutathione in several supplements in our office, and a lot of them are liver detoxing, so our paleo kit, our detoxification kit. But we actually have glutathione pure in several forms, and I'll get into that in just a moment as far as the best way to get it, I think. So the significance of glutathione, this was really good. This diagram shows it kind of like a ticker tape of why it's so good, what it's needed for. So glutathione is the guardian of the cell. It's the master antioxidant in each cell. This is the most potent. It is stronger of an antioxidant than vitamin C, than vitamin E, than vitamin A. It is the master antioxidant. It's the master anti-inflammatory in each cell. So if you have a lot of inflammation and you're suffering from diseases of inflammation, cancer, Alzheimer's, dementia, neuropathy, autoimmune disorders, diabetes, heart disease, these are inflammatory conditions. And part of it is because we start to have a diminished amount of glutathione in our system. We're not able to replenish or build or make enough to keep up with the toxic load. And so we end up with inflammation. And so glutathione is very important as an anti-inflammatory. It's the master detoxifier inside of each cell. So this also tells you it's very important that not only do we make glutathione, but we actually get it within the cell itself. So if you're going to take it in a supplement form or in some type of oral or IV form, you need to make sure it's in a form that's actually going to A, get into the body, and B, once it's in the body and flowing through the blood or the tissues, that it's actually being taken into the cell to function as an anti-inflammatory, antioxidant, and detoxifier for each of those cells. It is a primary detoxifier of heavy metals, and we are exposed to heavy metals all the time. Even if you have metal fillings in your teeth, you are constantly off-gassing mercury and cadmium and nickel. These are the prime metals that make up the fillings in most people's teeth. But vaccines have mercury and aluminum in them. These are toxic heavy metals. And glutathione is the primary detoxifier of these heavy metals. It helps your body bind these metals safely and eliminate them through the system. It's a chelator. So again, that's part of how it works. It's why it's so effective at getting rid of toxic metals, especially mercury. It transforms hemoglobin, that's part of your red blood cell, into its reduced state, which enables it to accept oxygen and carry it into the cell. So it's a necessary thing to help transport oxygen from the blood into the cell. Major protector of the mitochondria in the cell. That's the part of the cell that makes all of your energy. Major protector of the nucleus of the cell and the DNA of the cell. That is where your entire blueprint is contained. Major protector of the immune cell and the immune system. Cardiovascular system enhancer. And it's the only antioxidant that can actually recycle itself, right? So it is the first line of protection against environmental chemicals and toxins. So if you are going to get low in this particular nutrient in the system, a nutrient we should be able to make on our own, imagine the disease processes that can set up. So it's considered, and this came from The Truth About Cancer, which is a very informative website. Glutathione is a key for preventing aging, cancer, heart disease, dementia, and more. It's also essential for treating everything from autism to cancer to Alzheimer's disease, etc. It supports the immune system, helps to prevent and treat cancer. And remember, I did not say this, but WebMD also said this. Removes free radicals and heavy metals from the body, recycles antioxidants for reuse, master detoxifier, and the most powerful antioxidant. Helps control and reduce inflammation, which is the major source for most diseases. This was a good one because this is like, okay, so why are we getting so depleted, right, of glutathione? Well, your liver is the major organ that makes most of it, although all of our cells have the ability to recycle and convert it. These are all of the different things that can cause glutathione depletion. And I just want you to think about your own life as I go through this list. Aging. Okay, we're all aging, right? It really, anyone over the age of 30 or 40 years old needs to start looking at taking glutathione in some type of supplement form. Oxidative stress. This is exercise even is a form of oxidative stress. So if you're trying to keep healthy, keep your muscle tone, keep your bone density, you're going to the gym, you're working out, that is oxidative stress. And that can cause over time glutathione loss because it is still a stress to the body, right? Anything that burns oxygen is something that will cause you to utilize and potentially lose glutathione. Stress, who has stress, right? That's everybody, and it's not going away. Drugs, so whether it's recreational drugs, alcohol, or prescription drugs, all of these things, in particular, the more toxic they are, like all the way up to the worst is chemotherapy, these are going to be major pushers of losing glutathione. Pollution. We live in the Metro, DC, Virginia, Annapolis, Maryland area where we're commuting. Sometimes our patients are commuting up to 2 hours a day one way. So that's 3 to 4 hours a day of total commute. A lot of pollution. If you live in a large city, you're dealing with a lot of smog, pollution in our water, pollution in our food, glyphosates, herbicides, pesticides, food coloring. All of this is pollution. The toxins in your own home, your hair products, your skin products, this is all pollution. Buildup of toxins, of course, coming from that. Radiation. So we just talked about chemotherapy. Radiation is also a prime source of glutathione depletion. So if you have been through chemo and radiation therapy, you are going to want to look at taking an ongoing support of glutathione. And even if you haven't been through that, I recommend this. And so you can imagine if you've already been through that, how much more you might need it. Poor diet, which, listen, if you're even half as good as most of the people out there, you're still going to end up struggling because we just do not have quality, great sources of food anymore, no matter how healthy you're trying to be. Injury, burns, and trauma. Okay, so your diet is healthy, you're exercising regularly, you're sleeping well, you're doing all of these things, you're minimizing your stress, and boom, one day you get into a fender bender and now you have an accident. That can cause a major depletion in glutathione. In fact, I actually read a study where they made little mice in the study end up with a concussion. And what they found is that that concussion actually caused a super depletion in glutathione within the brain itself very quickly. And that head trauma started to cause brain degeneration later in the life of these mice. And what they found is that they supplied glutathione right away as soon as that trauma had occurred. And for a period of time after, it literally stopped that aggressive brain degeneration caused by the trauma. So trauma, burns, injury, these are also issues that can cause glutathione loss. Buildup of free radicals, that's just getting through your day. And infection. We test our patients for infections, whether it's yeast or candida or Epstein-Barr virus or Lyme disease. If you have Lyme disease or a viral type of overload, this is never going to go away. It's a matter of supporting your immune system to keep it strong and to keep the virus and the Lyme and the bacteria and whatever under control and in normal levels so it doesn't hijack the body. And glutathione will get depleted because of the infection, and you need to be having high amounts of glutathione in order to keep your system going long term. So I bet any one of you listening to this right now, just going through this little bubble scenario, you could check off at least half of these, because this is just life on planet Earth as we know it right now. And so all of these things, just being human and walking around and going about your day, literally causes a significant glutathione depletion. So the diseases with documented links to glutathione. So these are going to be things that are documented in actual good foundational research. We've got it sectioned off here: neuro and brain, Alzheimer's disease, Parkinson's, Huntington's, ALS or Lou Gehrig's disease, which is an autoimmune disease, migraines, multiple sclerosis, another neurodegenerative autoimmune disease, autism, ADD, ADHD, bipolar, depression, cardiovascular. We've got atherosclerosis, angina, erectile dysfunction, which is a cardiovascular disease. It's inflammation and blocking of the blood vessels, hypertension and stroke, immune system and cancer. People with low glutathione are more prone to HIV and AIDS, cancer of all kinds, especially breast, because breast cancer, especially if it's an estrogenic or an estrogen dominant type of cancer, glutathione can actually help prevent the estrogen from going down the cancerous pathway and keep the estrogen in the healthy pathway. And so that's how it can literally prevent breast cancer. And there's ways of using our oral supplements directly on the breast tissue itself or whatever tissue is of concern. But specifically with breast tissue, you can actually apply it directly to the breast and work to try to block that conversion of estrogen into the cancerous form of it. Lupus, viral infections, asthma, acne, Lyme disease, allergies, gingivitis, or rheumatoid arthritis, thyroid and pancreatic function, diabetes, pancreatitis, hyperthyroidism, and hypothyroidism. This is a bulk of a lot of what we work with in our office. And then just general other things: accelerated aging, arthritis, chronic fatigue, COPD, gout, hepatitis, which is liver inflammation of any kind, infertility, eyesight issues, including macular degeneration, gastric ulcers, inflammatory skin conditions. This is pretty much everything. So who needs glutathione? Basically, after that, you can see everyone. If you are a smoker, you need glutathione. If you're 30 years old and above, you need glutathione. If you drink alcohol, you need glutathione. If you have a generally depleted, low-functioning immune system, you get sick all the time, you're tired all the time, you never really feel 100%, you need glutathione. Recovering sickness and operation, if you've had any type of thing, even if it's just pulling a tooth or something, glutathione. If you have any liver problems, you've diagnosed with thyroid problems, history of eye issues, cataract issues, low quality and low sperm counts. If you've ever had a history of cancer or have a family history of cancer, so there's that potential, you want to be taking glutathione. Mothers who just gave birth, that is a major hormone shift, and it is a trauma to the system. It's a huge shift in the physical and chemistry of the mom. If you had chemotherapy or radiation therapy, exposed to other chemicals, maybe you're exposed to high chemicals on the job. Even if you're an interior designer or you work with a construction crew, you're dealing with a lot of off-gassing of a lot of different chemicals as far as fabrics, paints, stains, wood chemicals, furniture chemicals. I mean, we're just exposed to a ton of chemicals. And then anyone who consumes fish oil and VCO. Okay, so let's talk about good sources of glutathione. So this is our web store, My Living Health or Living Health Market. You can get access to it by going to Living Health Market, or mylivinghealth.com is our main website. You can see it there. Glutathione, we have a few different forms of it. We actually have it in a liquid pump, which I'm going to talk about today. We can do it through IV, although we generally will not recommend that as the first choice for a few different reasons. And then we have it in pill form. And then we have it also mixed into some of our meal shake, our meal replacements, especially the hepatogastro because it's a major liver detoxifier. It's in our paleo detox kit because that's anything having to do with liver detoxification. We usually add glutathione to it. But glutathione is made of 3 amino acids, so it's basically a protein. And when you consume it orally in a pill form, for example, you're going to break down the protein. So the absorbability across the gut lining into the bloodstream is not necessarily that great. So IV would be the next way because you'd be getting it directly in, by intravenous into the venous system, into the blood supply. But you're getting a form of glutathione that is not necessarily really easy to go from the bloodstream across the cell barrier into the cell itself, which is where you need it to work all of its magic. And so this form of glutathione, this is in a pump, our glutathione PL 100. It's PL is short for phospholipid, because what we did is we had the glutathione reduced down to nanoparticle size. I'm going to show you this. This is a picture of what this looks like. So there's a lot of liposomal supplements out there. What that means is see these red balls here? This is kind of like a representation of what your cell membrane looks like. So it has these red balls, which are little fat blobs. And then there's the whole membrane around the outside here is basically fat, okay? And so what happens is you have these red blobs that are attracting things that are okay in water. Then you have this middle yellow part that's basically the fatty part. So this is where your omega-3s are important. Your coconut oil, fish oil, things like that, other types of oils that we need to build a good cell membrane. This makes it very hard to penetrate. So anything just floating around outside the cell isn't going to just bust into the cell, right? It has to be definitely invited in through this little part here. What we did is we had the glutathione reduced to nanoparticle size. So it's very, very small, and it can actually be small enough to go into the cell. I mean, glutathione itself is small enough to get into the cell. But we wanted to put it in a form that would actually be very easily integrated and pulled through the cell membrane immediately upon contact. And so we have this little nano carrier, which is like a little tiny version of a lipid membrane. And within that is our nanoparticle glutathione. And so this whole little nanoparticle is very easy to get into the cell membrane, right into the middle of the cell. So that is probably one of the most effective ways of getting it into the system, even better than just regular liposomal. It is nanoparticle, which means it's so tiny that it can fit into the cell very quickly. It can also cross major barriers like the gut barrier, the cheek barrier, the skin barrier, and the blood-brain barrier as well. So we know that this will get into the brain. We know that this will get into your cells. In fact, if you look at the data on the specific manufacturing data on our supplement, the nanoparticle, right here, our liposomal delivery system protects the glutathione from digestive enzymes that otherwise prevent absorption of oral glutathione supplementation. And in cell cultures, so ours has been tested scientifically, in cell cultures has been demonstrated over 100 times more efficiency for intracellular delivery than IV-based glutathione. What that means is it's 100 times more likely the stuff that we give you to actually get into your cells than even IV. That is one of the reasons why we don't necessarily promote the IV glutathione in our office. So it comes in a little pump, right? You guys have seen this, some of you. Yeah, and the pump is very easy. One good dose is 4 pumps. You take it about 10 to 15 minutes before you eat. Ideally, if you can do it first thing upon awakening, and maybe even before bed or sometime mid-afternoon, half hour before dinner. If you were doing a heavy dose, you'd do 2 of these, 4 pumps twice a day. It goes right into the mouth, and you want to spread it around the mouth and kind of have it hang out there so that it gets exposed to all the cells and membranes of your cheek and tongue area. And you want to have it sit in the mouth for about 30 to 60 seconds, and then you can go ahead and swallow it. It will literally absorb in through the cheek, and it is very, very, very absorbable in this manner. And so one 2 pumps, I mean, 1 serving size is 2. We usually high dose people as far as that. So 4 pumps is going to give you 200 milligrams of almost 100% absorbable glutathione. And that's in this little part of here, that the phospholipid part, the phosphatidylcholine, that is the fatty acid part that is helping to create those little nanoparticles. So super awesome supplement. You can find it on our website, Living Health Market. Of course, those of you that are patients of ours, if you're popping in for your visits, you can pick it up in the store, in our office. Keep it in the refrigerator. This is one of the most effective forms of glutathione. And you can see now why we basically have everybody on this. It is one of our top 5 for lifetime supplementation, lifetime nutrients, especially if you're trying to age gracefully and with good quality of life, not just quantity of years, but quality of life. So I hope you found this educational and informative, and I hope you now have a better understanding about what glutathione actually is and why it is so important, and why we recommend you have it in a supplement form in addition to just eating your food. All right, have a great day, guys.